Pancreatic cancer is a type of cancer that begins in the tissues of the pancreas, a glandular organ located behind the stomach. The pancreas plays a critical role in digestion and blood sugar regulation, producing enzymes for digestion and hormones, including insulin, that regulate blood sugar. Pancreatic cancer is one of the more aggressive and challenging cancers to detect and treat due to its tendency to progress quickly and cause symptoms only in the later stages. Types of pancreatic cancer. The pancreas contains two types of cells, exocrine and endocrine cells, which can develop into different kinds of tumors. Exocrine tumors. These are the most common type, making up about 95% of pancreatic cancers. Adenocarcinoma is the most prevalent form, typically originating in the ducts of the pancreas. Other rare types include acinar cell carcinoma and intraductal papillary mucinous neoplasms (IPM-BENS). Endocrine tumors, also called pancreatic neuroendocrine tumors or NETs. These are less common and arise from the hormone-producing cells. They may produce excess hormones, causing specific symptoms depending on the hormone affected, and include insulinomas, glucagonomas, and gastrinomas. Risk factors. Certain factors can increase the risk of developing pancreatic cancer. Age. Risk increases with age, with most cases occurring in individuals over 65. Gender. Men are slightly more likely to develop pancreatic cancer. Family history and genetics. Having close relatives with pancreatic cancer, or genetic syndromes like the RCA mutations, Lynch syndrome, and hereditary pancreatitis, increases risk. Chronic pancreatitis, long-term inflammation of the pancreas, especially when related to smoking or heavy alcohol use, raises the risk. Diabetes. Type 2 diabetes, particularly when it is long-standing, is associated with an increased risk. Smoking. Smoking is a significant modifiable risk factor, with smokers twice as likely to develop pancreatic cancer. Obesity and diet. Obesity and diets high in red or processed meats are associated with a higher risk. Symptoms in the early stages. Pancreatic cancer often produces few symptoms, making it difficult to detect. As the disease progresses, symptoms may include abdominal pain, pain in the upper abdomen that may radiate to the back and worsen after eating or when lying down. Jaundice, yellowing of the skin and eyes, dark urine, and pale stools due to bile duct obstruction. Weight loss. Unexplained weight loss and loss of appetite are common in advanced stages. Nausea and vomiting. These symptoms can occur when the tumor presses on the stomach. New onset diabetes. Sudden onset of diabetes in older adults may be an early warning sign. Changes in stool. Oily, pale, and foul-smelling stool. Steatorrhea can result from the pancreas not producing enough enzymes to digest fat. Diagnosis. Diagnosing pancreatic cancer typically involves a series of tests and procedures. Imaging tests. CT scan provides detailed images of the pancreas and helps detect tumors. MRI and MRCP, used to view detailed images of the pancreas and surrounding ducts. Endoscopic ultrasound. To use an endoscope with an ultrasound device is used to get close to the pancreas and obtain images or tissue samples. Biopsy. Biopsy. The biopsy involves removing a small tissue sample from the pancreas for microscopic examination to confirm cancer. Blood tests. CA19-9, a tumor marker that may be elevated in pancreatic cancer, though it is not specific and can be elevated in other conditions. Staging tests. Additional imaging or procedures may be needed to determine the stage of cancer, assess if it has spread, and guide treatment options. Stages of pancreatic cancer. Pancreatic cancer is staged from 0 to IB. Stage 0. Cancer is confined to the top layers of pancreatic duct cells in situ. Stage I. Cancer is confined to the pancreas. Stage II. Cancer has spread to nearby tissues and possibly lymph nodes but not to distant sites. Stage II. Cancer has spread to major blood vessels or lymph nodes near the pancreas. Stage IV. Cancer has spread to distant organs, such as the liver, lungs, or other parts of the abdomen. Treatment depends on the stage, type, and overall health of the patient and may involve a combination of surgery, radiation therapy, chemotherapy, and targeted therapies. Surgery. Whipple procedure. Pancreatic duodenectomy, the most common surgery for tumors in the head of the pancreas, involves removing part of the pancreas, the duodenum, a portion of the stomach, and the bile duct. Distal pancreatectomy, removal of the tail and sometimes part of the body of the pancreas, usually performed for tumors in these areas. Total pancreatectomy, removal of the entire pancreas, though it results in the need for lifelong insulin and enzyme replacement. Chemotherapy. Chemotherapy is used before neoadjuvant or after adjuvant surgery and is the primary treatment for advanced stages. Common drugs include gemcitabine, fosfirinox, a combination regimen, and nab-paclitaxel. Radiation therapy. Radiation may be used in combination with chemotherapy to shrink tumors or manage symptoms in advanced cancer. Targeted therapy. Certain drugs, like PARP inhibitors, target specific mutations, such as BRCA, and are used for some types of pancreatic cancer. Immunotherapy. Immunotherapy may be beneficial for a small subset of patients, particularly those with specific genetic profiles, like microsatellite instability high MSIH tumors. Prognosis. Pancreatic cancer often has a poor prognosis because it is typically diagnosed at an advanced stage. 5-year survival rates for pancreatic cancer vary by stage. Localized early stage, approximately 37% survival rate. Regional spread to nearby structures, approximately 12% survival rate. Distant metastatic, approximately 3% survival rate. Prevention and risk reduction. While not all pancreatic cancer cases are preventable, certain lifestyle modifications can help reduce the risk. Avoid tobacco. Smoking cessation significantly reduces risk. Maintain the healthy weight. Achieving and maintaining the healthy weight reduces risk. Limit red and processed meats. Eating a balanced diet rich in fruits, vegetables, and whole grains may lower the risk. Manage chronic conditions. Proper management of diabetes and pancreatitis can reduce risk. Regular monitoring for high-risk individuals. People with a family history or genetic predispositions should consider regular screening. Conclusion. Pancreatic cancer is a serious and challenging cancer due to its rapid progression and typically late detection. Awareness of risk factors and symptoms, early diagnosis, and advancements in treatment are critical for improving outcomes. Individuals with risk factors or concerning symptoms should consult a healthcare provider for appropriate evaluation and guidance.